This is Dr. Daphne Adut. Will you talk about this a little bit?
Hi, Dr. Phil.
Clearly, co-sleeping in the same bed under one is not advised, right?
Yeah, it's definitely not a good idea, but you want it to be with your baby. And the American Academy of Pediatrics actually definitely recommends that baby co-sleeps with the parents in the same room to prevent sudden infant death syndrome. But what that co-sleeping means is not to have baby in the same bed. But there is something called a co-sleeper, which is a bassinet with an open area where you can attach it to your bed. And when you need to breastfeed her or formula feed, you just bring her in the bed, put her back when you're done, or even a standalone bassinet. So those things can definitely prevent sudden infant death syndrome. There's other things that you can do is definitely have the baby laying flat on their back. It's called the Back to Sleep campaign. So laying baby back on a firm surface, not an air mattress, not something with there's a lot of down pillows and blankets, completely flat with no teddy bears or anything else in there, really would help the baby sleep better and breathe better. Because babies are obligate nose breathers. What that means is they only really know in the first 3 months of life how to breathe from their nose. So if that nose is covered, they don't know how to breathe from their mouth. And the other problem is if you're gonna have baby in bed with you and you're a heavy sleeper, there's a chance of rolling over the baby, there's a chance of just putting your arm on there and blocking their airway, and so definitely it's not a good idea. But in general, it is a good idea to have baby in the room with you. But again, just looking at your story, at the time, you were teenagers. That's a risk factor for sudden infant death syndrome. That's one of the biggest risk factors. Other risk factors include smoking, drug use, alcohol. There may have been some of that going on. I don't know with Madeline specifically if she was born as a preemie or underweight, or if there are any other possible brain problems that we didn't know about that could affect her breathing center. That could also be a problem. And if there was no prenatal care, if you didn't have support, which well may be the case, that is also another risk factor. Just as Dr. Phil was saying, you had the best intention in mind, but what I do with my patients is I just definitely give them that anticipatory guidance of making sure that if you're gonna be taking care of your baby or if someone else, make sure they know to completely lay them flat on their back. As they grow, they can start turning over and learning how to breathe better on their own. That point is fine, but in the first crucial 3-4 months of life, back to sleep is the way to do it.
Yeah, so firm mattress, tight,
Yeah.
no animals to block, that sort of thing. And if you know that, maybe we wouldn't be in this situation today. But maybe we would, because there are a lot of factors that feed into this.
Right.
This may have had nothing to do with what appears to be obvious because there are other factors that could have contributed to it. We just don't know.